more cases to emerge from this cluster of infections.
The genesis of all this was the 3rd of October visit to a tavern in Quickney, which was subsequently followed by a bash, which is the 10-10-2020 bash that happened in Quickney on the 10th of October. There was non-compliance allegedly in both those instances, where, upon investigations, the students that tested positive revealed to us that no masks were worn, there was close dancing, no social distancing, there was sharing of bottles in terms of consumption of liquor, no sanitizing, no washing of hands. And then also in terms of the numbers, there were close to about 300 or more patrons that visited both the tavern as well as the bash. As we speak, right now the numbers are streaming in terms of the positive cases, and we're monitoring the situation very, very closely.
Well, to unpack those issues, we are joined via Zoom by family physician Dr. Fundile Nyati. Dr. Nyati, a very good evening to you. Thank you so much for joining us. Welcome to the Globe.
Good evening to you and good evening to your viewers.
All right, there we go. Thank you so much for joining us now, Dr. Nyati. Now, there were fears of a second wave, but it seems that such fears are being confirmed with South Africa surpassing the 700,000 mark. And most recently, we've seen 30 Fort Hare University students being infected with the virus. It does seem like the second wave is already in our midst, isn't it?
Well, there is enough evidence that we are beginning to get into the second wave. And in fact, when one looks at the other countries that have had the second wave, like even in the US, the second wave started with, the younger people who were attending these social gatherings. And what we are hearing from Fort Hare is exactly that young people attended, a social function, and there was no adherence to the measures. And this is what we are seeing now. Younger people who are getting infected in numbers.
And the fact that South Africa has already extended the national state of disaster, isn't it an indication that we still are struggling to contain the spread of this virus?
Well, I think, when one looks at this whole thing, we have done relatively well as a country, in spite of the fact that some people were not adhering to the measures. But what we seem to be seeing now during this level 1 is that people, they seem to think that we are out of the woods. They are not listening to the advice that's coming from the ministry. As a result, when you go around, whether you're going to malls or other places, most people don't have their mask on, or if they do have them, they are not applying them in the right way. So I think there is this, we've lowered our guards generally as a population. And now that becomes a problem of us as a population more than what the government has to do. We need to take responsibility.
Okay, in as much as we have lowered our guards on the one hand, but then some health experts have said that the coronavirus does not necessarily thrive in warmer temperatures. We are well into the spring season, and it's getting warmer and warmer here in South Africa. And also on the global stage, South Africa has dropped quite dramatically to 11th position now. So what could possibly necessitate the fears of a second wave?
Well, I think the idea that the warmer temperature would then, almost eliminate the virus, I don't think it's scientific. It was a hypothesis that many people were putting forward. But if we just look back at the US, during their summer, which is usually around July, the numbers have been going up and up and up. So, yes, we saw the numbers dropping in Europe and other parts of the world, but it did not happen in the US. So even here in South Africa, we must not fool ourselves that because we are getting to warmer temperatures of spring and summer, then we think that alone will actually make the pandemic to go down. No, it is not the case. So that hypothesis has not been proven.
So should we consider or overlook the improvement in the recovery rate? Should we focus on the cases overall or the infection rates overall, including those who died, including those who have recovered from this virus? Or should we, focus on the active cases?
Well, one good thing about this whole pandemic, there's nothing good about the pandemic, but when one looks at the death rate of South Africa to date, we are at 2.62%. That means, really, when one looks at the average of about 4 to 5% elsewhere in the world, and we are at 2.62%, very few of our people, succumbed. And the majority of those people are people with pre-existing health conditions. So I think the focus has to be on the, new cases, trying to reduce that, and also the active cases, especially those who are high risk, because we can still do something about those. The numbers now are nowhere close to the peak, during the middle of July up until the middle of August. So we should be able to deal better with better capacity now. So let's try and get the message out there to people to continue to observe the measures so that there's less new infections. And those who are already positive, we closely monitor them and make sure that they do not get to a stage where they have to be admitted in ICUs and end up succumbing to the pandemic.
The WHO said a vaccine could possibly, be available before the end of the year. But we've seen yesterday or a couple of days before a certain city in Shanghai saying that they've already started giving vaccines, to people. Should we rejoice at the prospects of a vaccine?
Well, I'm one of those people who are optimistic about the vaccine. However, we also need to be practical, because for the vaccines to, be rolled out to the general population, there are certain steps that need to be looked at. We talk about phase 1, phase 2, phase 3, and phase 3 has to do with safety and efficacy. Now, what I heard about the vaccine from China is that from a safety point of view, it's been proven to be safe, but the issue of efficacy, has not been, conclusively, addressed, and therefore I think it's a bit premature. However, if I have to look forward, I think that the vaccines that are being studied, especially the one from Oxford, of which VIX is participating in that one, it's likely to be one of the first ones that will have passed, phase 3 by the end of this year, which then says, in the first quarter of next year, there may be a possibility that for those people who are high risk, it may be rolled out, and for the rest of the population, maybe in the second half of the year. So I think I'm much more optimistic about that. But the ones where people just want to get to the market quickly, we saw a similar announcement from Russia a few weeks ago. So Russia and China are just looking to get there faster than other people, but the issue of safety and efficacy, there are no shortcuts in that. But I am optimistic that there will be a vaccine come, the first or second quarter of next year.
Well, in as much as we need to embrace this optimism, but then we should also consider the fact that the third world countries are obviously at the end of the stick because, obviously the vaccine will start with those the highly developed countries who can afford this vaccine, isn't it?
Well, there are some countries like the US, that have been looking to secure the vaccines whenever they come out, for their people. But bodies, multilateral bodies, and bodies like the WHO, the United Nations, and the others have actually been putting pressure to say, when this thing comes out, when the vaccines do come out, there must not be an issue of, inequity in terms of access to those. So African countries and other developing countries should also have access to that. But for South Africa, at least the fact that we are also participating in the studies, especially the one from Oxford, it puts us in a better position that if it is proven and it's approved, then at least we'll be amongst those countries that will have it, first. But generally, the bigger bodies, the WHO and UN, actually want all countries to have access to this, irrespective of how rich or how poor the country is.
Now, Dr. Fundile Nyati, quite interestingly and quite alarmingly, South Africa still records the highest number of coronavirus infections on the African continent, and other African countries which have much bigger populations than South Africa have recorded relatively low infections. And one then wonders, because some of these countries whose public health response apparently necessitated or it was helped to deal with the previous pandemics, Ebola in particular. And if so, if that is the case, why then didn't South Africa adopt that particular strategy, in order to deal with the coronavirus?
Well, you're right about the fact that, in terms of the number of cases, South Africa has recorded the most number of infections, in the continent. We are number one in terms of the number of cases, followed by Morocco, Egypt, Ethiopia, and Nigeria. All right, so that's a fact. But in terms of whether the numbers that we are seeing in the other countries are actually as a result of the experience that they have in managing pandemics, before now, it's questionable. The other point one may have to put and say, how much testing was the capacity to test in some of these countries with, public health systems that are actually quite bad compared to what we have here in South Africa. So I don't think it's a very clear case that South Africa has not learned from the other countries. If anything, it could well be that South Africa has actually been much more efficient in conducting the tests, and many people in the other countries have gone without being tested. So I have got a question mark with some of the countries. I mean, Nigeria, which is the most populous country in the continent, is showing as having it's number 5 in the continent, with only about 61,000 cases as compared to our 203 kind of cases. So I think there's arguments on both sides. I think South Africa has done very, very well. With the WHO having come to our shores and looked at how we do things, I think we've done the right things, and we should just continue and learn from the experience. Not all of the African countries actually had Ebola. I mean, it's only the West African countries and the DRC that have got the Ebola problem. So one can't say the rest of the African countries got experience from such a pandemic.
Okay, so in short, Dr. Nyati, you are suggesting that underreporting of cases may also be a factor in the continent's low recorded transmission rates.
That is what I'm advancing, to say a number of countries, because the quality and the efficiency of testing is so much linked to the capacity of the countries. And we knew that a lot of countries in Africa are actually challenged as far as the health systems are concerned, let alone, the ability to monitor these kind of infections. So my hypothesis is that they have not been that efficient in testing, and that's why they are showing the numbers that they are showing.
Now, reports have come that Health Minister here in South Africa, Dr. Zweli Mkhize, has tested positive of the coronavirus. I mean, what does this mean, for the fight against coronavirus moving forward? I mean, for a man at the helm of the fight against this virus, succumbing to this virus, what does it mean for South Africa moving forward?
Well, I think what that shows is that there is no one, irrespective of their profession, irrespective of their leadership level, there is no one who is immune to getting infected by this virus. We have seen, Boris Johnson in the UK. We have seen, Trump in the US. We've seen, the leader of Brazil. So for South Africa, it's just something that reminds us that we must not keep our guards down. Even those people who are knowledgeable, who have been at the forefront of the fight, from time to time, they may actually lower their guards and get infected. So let's learn from that and continue to do what he's been preaching to us to do, which is to behave as if we are in level 5 or level 4 and continue to take precautions against this infection, especially when we get into places where there's a number of people, the crowded kind of places.
All right, Dr. Nyati, great chatting to you. Thank you so much for your analysis. We do appreciate your time.
Thank you very much.
All right, that was family physician Dr. Fundile Nyati. Well, he's been a friend of the SABC in terms of offering his valuable insights and his analysis on the coronavirus outbreak in South Africa. It is 9:46.